And I'm Dana Winklepleck. Well, many people kicked off the new year vowing to be healthier, maybe get in shape. Some people are leaning toward weight loss drugs that are gaining in popularity.
Shelby Riley spoke to local health and fitness professionals about the increase in the use of diet pills and injectables.
The interesting thing that's come up within the last couple decades or so is the number and type of weight loss medications has changed dramatically.
Dr. Scott Stein, CMO at Good Samaritan Physician Network, says diet or weight loss pills are nothing new. However, there has been a new push for weight loss injectables such as Ozempic. Many celebrities even announcing they use weight loss drugs.
The most interesting thing recently has been the promotion of medications that are injectable medications for weight loss, such as semaglutide, tirzepatide, those types of things, which are sold under the brand names of Ozempic and Zepbound and Mounjaro and those types of things.
Dr. Stein says previously, diet pills were some variation of an appetite suppressant. Some of the newer injectables actually started out as diabetic medications.
And what we have found is significant weight loss with these injectable medications that are once weekly. The thing that has changed within the past couple months or so is that specifically one of these medications was tested and shown to show up to about 20 to 21% body mass index loss, which is a big deal.
Brandon Smitley is the owner of Terre Haute Intensity Resistance and Sports Training, or THIRST. He says any type of supplement weight loss pill would not be the first thing they recommend.
In terms of the diet pills, we try to recommend to people to start with just normal food and exercise, sleep, hydration, and good quality electrolytes, and that sees a lot of progress, as it should supplement what you're already doing. So if you're starting something new, you don't need to supplement anything yet. Your supplement is the diet, the exercise.
Dr. Stein says if you want to start a weight loss journey, it's best to consult your primary care provider to determine the best course of action.
When we talk about weight loss, it's not just about I need a quick fix in terms of a pill or an injection. It's important to realize that we're talking about a behavior modification.
Both Smitley and Dr. Stein say that one should set realistic goals for yourself, and they want to remind you that what works for one person may not be the best plan for you.